The College of Physicians and Surgeons of Ontario regulates the province's medical doctors in the public interest. Working together, members of the public and members of the profession find ways to support physicians in providing quality medical care to patients.
Our job is to protect patients, and to do that, we register doctors. We assess them, and when we have a concern, we investigate doctors. Our goal is to ensure that each and every encounter that a physician has with us is fair and transparent and ultimately educational.
Throughout 2011, all our major activities and initiatives focused on 4 priorities: improving our registration framework, assuring and enhancing physician competence, improving our investigations, discipline, and monitoring processes, and pursuing operational excellence. 2011 has been a year of tremendous progress in each of these areas. Regulation in the public interest starts with registration. The registration process drives everything the college does and delivers the highly qualified doctors that we need.
We support system goals to ensure that there are enough doctors in Ontario to care for the patients of Ontario. Our specific role is to provide flexibility that allows candidates to fulfill our entry to practice requirements. We do this without compromising standards or quality.
In 2011, we registered a record number of new physicians to practice medicine in this province. To facilitate the registration of physicians, we have improved our application process. We have made the process faster and more transparent. Practicing medicine is challenging. Dealing with the college should not be.
We assure and enhance physician competence in a number of ways. It can mean being assessed by another doctor in the same specialty. It can mean providing guidance in practice matters. And it can mean helping doctors create a plan for further learning.
Supporting physicians in their decision-making and lifelong learning helps Ontario doctors and ultimately their patients. To better understand where a physician can improve, we begin with assessment. Physicians who have been assessed through our program report that the feedback helps them provide better care to patients. Our goal is to assess every doctor every 10 years. In 2011, we assessed 2,668 physicians. Of those who were assessed by their peers, 85% were found to be practicing at the expected standard. 10% had minor record-keeping and quality of care concerns. A reassessment will see if improvements have been made. And 5% were found to have more significant educational needs. For those physicians with significant needs, our Quality Assurance Committee will mandate further learning and develop a more structured plan of education to help support changes to the physician's practice. Like all our committees, the QA committee is made up of physicians and public members of council. We strive to develop educational plans customized to the individual physician. And over the last year, there has been more focus on how we measure outcomes in practice.
The college has come to understand that some educational activities are more valuable than others. Just attending a course, for example, doesn't necessarily help a doctor focus on the areas where education is most needed.
What we're looking for are meaningful, measurable outcomes. If a physician who was a poor communicator can now be described by his patients as thorough and responsive, then the college's intervention has made a difference. We want to see lasting changes in day-to-day practice.
And we want all physicians to participate in lifelong learning, not just those who have run into difficulties. In 2011, we welcomed the government's support of our request to make continuing professional development mandatory for all physicians. We recognize, of course, that doctors don't practice in a vacuum. In 2011, we completed our first year of regulating out-of-hospital premises. In these higher-risk healthcare settings, we inspect both the facility and assess the practitioners. There are many other ways we work to enhance physician competence. For example, we develop policies that guide physicians in their practice. This assistance makes it possible for patients to receive a consistent and reliable standard of care from all Ontario physicians. In 2011, we consulted broadly with the profession, the public, and other stakeholders to produce 2 important policies. Sometimes, we will receive information raising possible concerns with a physician's care or behavior. A duty of self-regulation is to investigate such concerns. All cases are considered by the college's Inquiries, Complaints, and Reports Committee. The committee examines the facts and decides how the matter would be best resolved. The committee has a number of options in resolving a case. In some instances, the committee may refer a doctor to the discipline committee. This happens in a very small percentage of cases. Generally, it is required when a physician appears to have engaged in egregious behavior, or where a physician appears to have demonstrated substandard care and does not appear capable or interested in remediation, or where there is a risk to patient safety. In 2011, the Discipline Committee completed 34 cases. 43% of the cases involved clinical concerns. 30% of the cases focused on allegations of disgraceful, dishonorable, or unprofessional conduct. 13% of the cases involved physicians who were found guilty of an offense relevant to suitability to practice. And 13% of the cases involved allegations of sexual misconduct.
Keeping patients safe is at the heart of everything we do. That's why competence and integrity are essential requirements for those who wish to practice medicine.
At the college, we believe that we should demand as much from ourselves as we do of our doctors. Over the past year, we have focused on improving many of our internal systems to be as effective and transparent as possible. For example, we were able to reduce the amount of time that patients and physicians had to wait for a decision. But the timeline for a decision is still longer than we wish. That is because of the sheer volume of cases that we consider.
Patients will benefit the most if we can ensure that our resources are focused on those individual situations that signal potential risk. Unfortunately, we're hampered by legislation that treats all public complaints identically. That's why we decided to ask the government to allow us greater discretion in the investigation of complaints. We could then give priority to those cases where patient safety is at risk. We hope the government agrees to our request.
We have accomplished much this past year, but we know there is more to do, and earning public trust is something that we work on every day.
We want Ontario patients to feel confident in Ontario doctors because they trust us to regulate with integrity.